Hi, myself Dr. Suresh Giragani, intervention radiologist at Yashoda Hospitals, Secunderabad. Today in this video, I am going to describe about the latest advanced treatment, mechanical thrombectomy for the treatment of paralysis or brain stroke. So as you all know that majority of these brain strokes are due to blockages supplying the brain blood, blockages in the brain blood vessels supplying the brain. So the main treatment option which is available for the last 15-20 years is injection treatment or thrombolysis, which can be done up to 4.5 hours if the patient reaches to the hospital in 4.5 hours. And the latest treatment, which is the thrombectomy, wherein we try to pass a small tube from the groin into the brain by passing small tubes and further placing stents or some vacuum kind of tubes across the clot and remove the clot from the brain blood vessels. This is called as thrombectomy. This can be done up to 24 hours. So this particular thrombectomy treatment we have been doing in Yashoda Hospital, Secunderabad for the last 5-6 years, and we do close to 100 cases per month. And in this video we are going to describe such a case, one of those such case wherein how the patient reached the hospital, what are the symptoms, and what kind of any test, the investigation what we have done, and what are the treatments given, and how the thrombectomy treatment was performed, and what was the outcome, what was the result, and how he recovered in the hospital. Everything we are going to show in this particular video. So this patient is a young boy. He is a 19-year-old engineering student. He came to our hospital with complaints of right-sided paralysis. Means he is not moving. As you can see, when we are instructing to him to do, he is not able to move his right hand and right leg. At the same time, there is deviation of the mouth, angle of mouth, and as you can see that he is able to lift his left leg as well as left hand, but on the right side he is not moving. So this is nothing but paralysis. So whenever paralysis is recognized and patient who are in this window period of 24 hours, patients coming within the window period of 24 hours, we immediately activate what is called a stroke code. So in this stroke code, all the departments concerned regarding this treatment of this acute stroke are activated by messages as well as voiceovers. And in this case, we did the stroke code announcement. Once it is done, then patient is further investigated with an emergency MRI of the brain. So MRI brain, what we do basically in MRI brain, just like ECG for the heart attack, MRI or CT scan is a must for the brain attack or the paralysis. The MRI will come to know what is the extent of the damage, where is the damage, whether it's small brain or the forebrain or the big brain, whether it's right side or left side, and is there any blood vessel blockage or a bleeding. Everything will come to know in the MRI, and extent of those blockages, extent of the damages, everything will come to know. And this MRI is done usually in a span of 8 minutes. It doesn't take much of time. And once MRI is not done, so we'll get such kind of photographs or images. You can see these white color areas are nothing but the damaged areas. As you can see, one half of the small brain is starting to be damaged, and there is a, in the sixth image you can see that the brain blood vessel which is supplying the small brain is blocked, which is called as basilar artery, and much of the small brain is still yet to be like it is spared, or means it is not a damage. So that area we can salvage, or we can prevent from damaging further if we can open up this particular blocked blood vessel. If we can restore the circulation by clearing or opening the blockage within the blood vessel, then the patient is going to have recover by preventing further damage in the small brain. So that is what we have decided, and then we try to counsel the patient attendance, patient party on the same lines, that what are the advantages of this particular treatment that we are going to do, which is called as mechanical thrombectomy, its pros and cons, and at the same time we try to do the financial counselings regarding the overall duration of the stay in the hospital, prospectively everything we try to explain. And once the patient attendants try to understand and everything, then we take the patient for thrombectomy. So this thrombectomy, once consent is given, is done in particular room or theater complex called as biplane angiography in our hospital. So it is a very dedicated neurovascular intervention unit wherein we can do all such kind of procedures, thrombectomy or any brain vascular coiling procedures, embolizations, in a very safe and faster way. And we have a dedicated staff for all these things. So as you can see that we are placing a small tube inside the right side of the thigh, the right thigh, right side, right thigh. We are placing small tube so that we can pass further smaller tube, throw it into the brain, as I've shown you in the previous video. So once we place that, as we are placing this tube at around 11:10, patient reached the hospital around 10 o'clock. So you can see our systems of care and triage. So once the plan is to pass either stent retriever, which is stent and basket type, retrieve the clot out, or pass a small tube, throw the groin into the brain, right up to the clot, and connect it to the suction pump. That vacuum, the vacuum created by the suction pump, takes out the clot or sucks out the clot out of the brain blood vessels and clears the circulation, and circulation is restored. So this is what we are going to do. In this case, we first we reach the neck of the patient. You can see the blue color tube which is placed from the groin. Through that we are injecting the dye and seeing what is the anatomy or what is the map, how we have to go. So these are the white color tubes you are seeing is basically a road map wherein we pass the small tubes. They are seen as a black ones and underneath this white map, and under X-ray guidance we pass them, and this is not going to take much of time. Usually in 10 minutes time, 10 to 15 minutes time, we'll be able to reach that particular site without much of difficulty. So we have these advanced hardware wherein these tubes which are specifically meant for the brain can be passed from the groin into the brain without much difficulty. And once it is placed across the clot or into the clot, then we connect it to a tubing which is connected to a vacuum pump or suction pump. So you can see that red color thing which is where the blood is coming out of, and it's connected to this suction pump, and actively the clot as well as the blood is getting sucked out. And once it is the blood is coming out, that means the circulation is clear, and immediately we check and see whether what's happening in the brain circulation to see whether circulation is restored. So as you can see that we did the this particular complete thrombectomy procedure within 15 minutes. 11:10 we started and 11:25 we completed. The faster you do this particular procedure, the recovery will be better, because you're not wasting much of time and every minute counts here. The brain keeps on progressing, like the damage keeps on progressing with every minute or every second. So the faster you open up the blood vessel or clear the blood vessel out of the clot, then the recovery will be faster. So we did it in a time span of 15 minutes. And after thrombectomy, then we check for the circulation, how is circulation, whether it's improved or not, partially improved. Everything will come to know on the table itself. Everything will come to know on the table itself. And apart from that, we do a CT scan on the table. We have the facility to do a CT scan within the cath lab. In the CT scan, we'll come to know is there any residual bleeding or residual clots are present, and is there any swelling inside the brain. Everything will come to know. These are the clots that we retrieved or extracted out of the brain blood vessel. As you can see, these are very small, tiny ones, and actually the blood vessels themselves are very tiny ones, but they are very vital because they are supplying small brain here in this case. So these are the clots. They can be soft or sometimes firmer rubber. So by different methods we try to retrieve them out, and so we can know what is the extent of the clot. All those things will come to know. So not only that, because we are not given any sedation, the beauty of this procedure is that we don't give much of anesthesia. Usually it is done under local anesthesia, means only in the groin region we give anesthesia. Patient will be mostly awake, or we'll give, if the patient is not cooperating, we give some sedation. And after the procedure we can assess how the patient improved clinically. Like in this patient, he's trying to lift his right leg right on the table, and his right hand also is trying to lift it up. So some improvement is there definitely on the table itself, which is not unexpected, because we did the procedure very fast and it came in the reasonable window period of 9 to 10 hours. And on the next day we'll do MRI scan, and as you can see here in this video, within the hospital he's walking. So this is not like miracle. It happens with thrombectomy. the patient reaches the hospital in a window period of 24 hours. We can do up to 24 hours such kind of procedures after the onset with the paralysis. So timing is very important. That means we should not wait till 24 hours. If the patient reaches the hospital as early as possible, means if the patient is coming in 3 to 4 hours, the recovery is much better as compared to a patient reaching the hospital after 12 hours or after 24 hours. But we can do these treatments up to 24 hours. And you can see him walking, talking, and we do see many patients who come out of the window period, and by the time damage is already established in the brain, and we won't be helping the patient much at that point of time. So doing thrombectomy beyond the window period of 24 hours sometimes may not be feasible, and awareness about this particular treatment and the timelines is very important for the general public, and so we should know about this latest treatment. So this is all about this particular treatment, the mechanical thrombectomy, and its advantages, pros and cons, when it is done, what is the window period, all those things we discussed in the video. Thank you.